In this video, I'm going to show you a sequence of movements to help you with knee pain. Knee pain is generally indicative of tension in the center of the body anyway, so I'm going to take you through a bunch of movements that are going to address the knees but also the center of the body as well. So for the first movement, we're going to begin on our back, knees bent, feet flat. And the first thing we want to address is the hip flexors, as they're the most central muscle that attaches to the spine and onto the leg. So we want to relax them first before we start thinking about the knees. So to do this, we're going to gently arch the lower back like so, rolling our pelvis towards our feet. And you'll notice as you do this, your tail presses down, your chin gets drawn a little bit down, and you'll feel the tension in your lower back. And from here, you're going to bring one of your knees towards your chest like so. So now your back is arched and your hip is flexed. This creates quite a bit of tension in the crease of your hip and in your back. And if you want, you can just adjust the angle of your knee a little out or a little in. One of these positions is going to speak to you a little bit more than the other. For me, it's a little bit out, and this is going to get your hip flexors and psoas. And from there, you're going to let your back gently drop down, and then slowly, keeping your back flat, let your foot come back down to the table. All right, and we're going to repeat that 2 more times. So we're going to arch the back, flex the hip, adjust a little bit the angle of the knee in or out, and then when you've found the position for your knee, slowly let your foot come down back to the floor, and then slowly let your back come down. Okay, and on the last repetition, we're going to try and let our back and our foot come down at the same time. So just take your time with this. Go ahead and arch your back again, rolling down, tail presses down, flexing the hip, knee position as you wish, and then nice and slowly, can you put your foot down as you let your back come down, like so. Okay, let's lay flat and see what we've got. Okay, if you've done that slowly and carefully, you should definitely get a sense of having a bit more space in the front of the hip on this side that you worked with. All right, let's repeat that on the other side so we can get both hips. So again, we're going to arch the back, and we're going to flex the opposite hip now, the second side hip. And again, you'll feel how this creates tension in your lower back and in the crease of your hip. From here, again, you can adjust the angle of the knee a little in or a little out to a position that speaks to you. And on the first one, we're going to let the foot come down, and then we're going to slowly let the back come down. And when you're ready, we're going to repeat that. Rolling into our arched back position, flexing the hip, adjusting the knee angle slightly if required. And this time we're going to let the back come down first, then let the foot come down with the back flat. Everything is done nice and slow so we can feel clearly what we're doing. And on this last repetition, we're going to try and let the back and the foot come down together. So roll into an arch, flex the hip or bring the knee toward the chest, adjust the knee in or out a bit, and then nice and slowly can you let the back and the foot come down together. And it is a little more challenging, but that's okay. All right, once you're done, legs straight, take a moment to see how that feels. And again, that should feel a bit more open and like a bit softer through the front of the hips, and the legs may even feel a little bit longer. Okay, so we've addressed hip flexion and taken some tension out of the lower back. These are all things that are going to help your legs and your knees feel more comfortable. From here, let's change gears a little bit. So bring the legs back to bent. And now let's talk about medial knee pain, which is pain on the inside of the knees. For medial knee pain, it usually indicates that there's tension in the inner thighs and groin. So let's address that now. So with your hands behind your head, we're going to bring the elbows in and curl up to look at our knees like so. Press your back down and just gently press your knees together. And in this position now, can you even lift up your bum a little bit and like you're squeezing something between your thighs. So you're going to feel a fair bit of tension in the inner thighs and in the belly. And then nice and slowly, let everything relax and just uncurl back to the floor. So you'll notice we're contracting not just our inner thighs and groin, but also our belly to connect it to the center. Okay, so let's repeat that about 2 more times. On the exhale, elbows in, curl up, press the back down, knees together, lift the bum a little bit. You're going to feel this very clearly in your legs. Make sure you can feel your belly is contracted, and then nice and slowly relaxing back to rest. And on this one, you can even let your knees start to tip out again to further lengthen those inner thigh muscles. Now let's just do this one more time. On the exhale, elbows in, curling up, flattening the back, knees come in, squeeze the legs together so you can feel your inner thighs and groin. tuck your tail, and then slowly and carefully relaxing back to rest, allowing the knees to tip out. Okay, and from here, let's relax. All right, so we've addressed the hip flexors and low back. We've addressed the inner thigh and adductors in conjunction with the belly now. That should be starting to feel quite different through the legs now and in your torso. But the legs should be starting to feel quite a bit more soft and heavy on the floor. So by releasing the inner thighs, that should help to ease medial knee pain. From here, we want to address a little bit into the fronts of the thighs now. So bring the legs to bent. We're going to do a interesting movement called step overs. So you're going to imagine like the action of the leg is like you're stepping over an obstacle. And we're going to work with this left leg first. And you're going to, if you need to press a little bit into the ground with your right foot to help you sort of stay stable, that's fine. So to begin, we're going to bring the knee toward the chest, the left knee, just a little bit of pressure through my right foot to help me stabilize. And then the action of the leg is as if you're stepping over an obstacle like so, and letting the leg come down and then straighten out completely. And we're going to repeat that a few times. Now, flex the hip, and as you're doing it, you can make the obstacle, the imaginary obstacle, bigger so that you have to step further, if you like, with the leg, so that the leg is closer to straight as it's coming down. And then when you get to the bottom, just completely relax. And let's try that again. Flexing the hip, stepping out over the imaginary obstacle to the point where the leg is straight, and then slowly lowering the leg all the way to the ground, keeping your back flat. Don't let your back arch up when you do this. If you can't do this with the leg straight, that's fine. You can put the leg down bent and then straighten it. Let's just do this one more time. Flexing the hip, knee to chest, keep your back flat, step out over your imaginary obstacle. Do the biggest obstacle you can manage, and then nice, slowly letting the leg come down to the rest. All right, let your two legs be straight, and just notice how that feels through the front of the left leg and hip. It should feel, again, just a little bit more soft, more open, and more relaxed. So let's try that on the second side so we can have two relaxed knees. So again, we're going to bring the knee to the chest. We can press a little bit through the left foot to help us stabilize. And on the first one, just imagine the obstacle is a little bit smaller. So we're not going to quite straighten out the leg. Let the leg come down a little bent. And then when the leg heel touches down, you can straighten the leg out. And we repeat. Knee to chest. Stabilize to the left foot. Step out over the obstacle. You can make the obstacle a little bigger now, so that the leg gets closer to straight as it comes down. Heel touches down, straighten out the leg the rest of the way. And we're going to do two more, and I'm going to do them with the leg straight. You just do them as well as you can, with the leg as straight as you can. Flexing the hip, stepping out over that nice big obstacle. The leg is straight as it comes down. The back stays flat. And you just gently and carefully rest the leg back down. Come to complete rest. And last time. Flex the hip. Step out over the obstacle. Keep your back flat. And you're bringing the leg down nice and slow, like a great big drawbridge. And the slower you go and the more you keep your back flat, the better this is going to be for you, the front of your leg. And completely relax at the bottom. All right, both legs straight. And just notice how that feels. Legs should be starting to feel quite different to how they did in the beginning now. We've relaxed the hip flexors and low back, the belly and inner thighs. Now we've gotten into the hip flexors and the quads a little bit, the fronts of the thighs. So we're starting to relax everything that is involved in the knee joint. So the legs should be starting to feel quite different now. Reducing tension in these areas is going to help to make the knees move more freely and feel more comfortable. All right, so next up, we want to address the outside part of the knee. So this area here, sometimes this area can be problematic for people as well, where they get pain on the outside of the knee. And to do that, we're going to need to be on our side. So let's change positions now. So for this, set yourself up on your side like this, and you can have your knees kind of at a 45-degree angle. And you're going to straighten out your top leg, your top side leg, and I want you to lift your leg up like so. And as you do this, just put your hand or your fingers right about where your pocket is. I'm right at the entrance to my pocket here, and that's exactly where the muscle group I want to get into is. This is your TFL. It attaches and becomes your IT band. And if this muscle is tight, it creates tension through the IT band, which creates pain down at the lateral side of the knee. So by lifting up the leg in this position, we can contract our TFL on purpose. And if you swing your leg just a little bit forward, that's going to get into it a bit more specifically, and pick up your head, point your ear at the same spot, at the pocket here. And then when you're ready, you're going to come down nice and slowly, letting everything relax at the bottom, and let your knee just softly bend and collapse and rest on your other leg. So let's repeat this a couple of times. Lift the leg, adjust the leg a little forward so you get more tension or sensation at this area at your pocket. And then if you want, you can just angle your knee ever so slightly down toward the table, and that's going to increase tension here a little more. And pick up your head, point your ear at the sore place or the tight place, and then as smoothly as you can, just start to come down. Let everything relax. Let your leg get heavy, and let the knee bend and come to complete rest. This is great if you get pain down the outside of your knee. And let's do this just one more time. Lift the leg up, angle the knee slightly, the knee and foot slightly down, and adjust your drift forward of the leg so you get a clear sense of tightness in this area at the pocket. Pick up the head, point your ear at the same place, the pocket, ties it all together, and then nice and gently and smooth and slow, you're just going to relax back to the floor. Okay, so 3 of them is usually enough. Let's lay on our back and see what we've got. All right, so that should feel quite different down the outside of that leg and hip. So compare the feeling of that side to the other side, and just notice what's changed for you in that regard. And obviously you're going to want to do that on the other side too, so let's change positions now. So everything's the same. Hips and knees at 45, straighten the top side leg, and we're going to lift just like we did on the other side, and just notice if it's easier on one side or the other. Generally, one side will feel easier. We're going to angle the knee a little bit down, the knee and foot, and we're going to adjust the leg position so we get a clear contraction in the area around the pocket here, and you'll probably feel it a little bit into the glutes as well. That's fine. Then you're going to pick up your head, point your ear at your pocket, and then slowly let everything come down. And you can let your knee softly bend at the end, and everything comes to complete rest. So we're contracting the muscles first so we can get them under our voluntary control, and then with the slow release, we're voluntarily releasing them. So again, pick up the leg, adjust the drift, turn the knee down a little bit, pick up the head, point your ear at the sore place or at the tight place here, and stay in this position long enough that you're clear on what you're doing, that you can feel the effort in your hip, side of your hip, and then you can come down nice and slow, nice and smooth, paying attention to that feeling of letting go of tension. And we'll do that one more time on this second side as well. So lift the leg, and you may need to readjust the position a little bit each time. Angle the knee and foot down a little bit. Pick up the head, point your ear at this pocket spot. And then when you're ready, nice and lazy on the exhale, you can relax back to rest. Let that knee bend. Okay, let's lay flat and see what we've got. All right, so now that you've done both sides, things should be starting to feel quite comfortable and soft through the lower body and legs. So we've addressed all the main areas that can kind of cause problems for the knees. And now we want to do a couple of movements to integrate and get some more control over the hips and legs so that the knees can be comfortable. Bring your attention to your left leg and just let your knee turn out a little bit and slide your heel, your foot, up in the direction of your bum, like so. And notice as you do that the knee tips out. Turn your head to the right and roll your hips to the left. And when you into this kind of a position, and from here just pick up your foot a little bit and then gently push your foot back down and straighten the leg out back to the start position. So there's a couple of things happening here, so just take your time with this. Left knee turns out. Slide the left foot up the floor towards your bum, keeping the knee out. Let the hip tip to the left, head turns right, and then just gently pick up your left foot off the floor a little bit, and then let it come back down and straighten the leg out. So in this movement, we're using the hip and the knee and the leg all together. Let's just do that one more time. Left knee turns out, slide the left foot up towards your bum, hip rolls to the left, head rolls to the right. You feel your back arch a little bit, that's fine, and then just pick up the foot a little bit. Let the foot come back down and straighten the leg out. And notice how that feels now that you're back straight. And now we're going to do the opposite movement with this leg. We're going to turn the knee in a little bit, slide the heel up the outside, hips roll to the right now, head turns left. And from here, can you pick up the foot a little bit like so? Use your trunk to do it, right? So kind of think of tilting your whole trunk to the right to help you pick up your foot. I'll let the foot come down, slowly straighten out the leg back to the start position. And let's do that 2 more times. Knee turns in, and we're just sliding the heel up the outside. And you're going to have to turn your hips to the right and turn your head to the left. And then the more you use your torso to kind of turn your hip, the easier it is to pick up the foot a little bit. And then slowly back to the start position. If you're finding the lifting of the foot difficult, that's okay. You can just do the sliding of the foot instead and just leave out the lift. One more time. Knee turns in, heel slides up the outside, hips turn right, head turns left. And if you're comfortable with lifting the foot, just lift it a little bit. And then slowly back to the start position. Okay. So we've slid the foot up with the knee turning out, slid it up with the knee turning in. We want to, if we can, alternate between those 2 positions. So let's give that a try. Knee tips out, slide the foot up towards the bum, turn the hips to the left, head to the right, slowly back to the start position. Knee turns in, slide the foot up the outside, hips turn right, head turns left, lifting the foot again. And we'll just do that one more time and see if you can make it feel smooth and easy. This is invert, evert. All right, and back to the start. Now, just rest for a moment and see how that feels. That should create, you'll probably find that creates a fair bit of difference between the 2 sides now. Because not only have you been using your knee, you've been using your hip, your ankle, your waist, your entire body to do that movement. And this is the best way to approach these things. Use all of yourself and you'll get a better result. Let's just try this on the second side. Turn the right knee out, slide the heel up towards the bum, turn the hips to the right, head to the left. If you're okay with lifting, just lift the foot a little bit and notice how it creates an arch in your back. That's fine, that's not going to help you. Then let the foot come down and then slowly back to the start position. And again, knee turns out, foot slides up to the bum, hips roll right, head rolls left. Lift the foot if you're capable. If not, you can keep sliding, that's okay. Straighten the leg back out, back to the start position. One last time, turn the knee out, slide the foot up, roll the hips to the right, head to the left. And then back to the start. Let's do the opposite movement now, turning the knee and foot in, sliding the heel up the outside, hips roll left, head rolls right. Pick up the foot a little bit if you can. Slowly put the foot down and back to the start position. And let's try that 2 more times. Turning the knee and foot in, sliding the hip up the outside, rolling the hips to the left, head turns to the right, and then if you can just lift the foot up. You'll need to arch your back, you'll need to involve your trunk in the process, and then let it come down. And then slowly back to the start position. And we'll do that 1 more time. Knee turns in, slide the heel up, lift the foot as you twist the body, and then back to the start. Now let's just do a couple of passes where we alternate the 2 actions. Knee turns out, Sliding the heel up, rolling the hips to the right, head goes left, lift the foot, gently back to start position, and going up the outside. And it should be starting to feel a bit more fluid now and a bit easier. Just take your time, do as much of this as you can, and moderate the size of the movement to make it comfortable. Okay, and then come to a rest. So we've already covered a lot of ground. We're going to finish off with just one more movement to tie this back to walking. So bring the legs to bent, but have the feet wide apart. Bring your attention to your left knee and just allow the left knee to start to drop in toward the right foot, rolling onto the inside edge of that left foot. And notice how this makes your pelvis roll to the right. So it's that same action of the pelvis we were using a minute ago, only we're doing a different action with our legs. And just turn the hips to the left a little more. You'll feel it makes the left side of your back lift up. That's okay. And just notice how the more your pelvis turns and the more your back lifts up, the more your knee drops down. And then slowly come on back to the center. And then we'll do that on the other side. Right knee tips in, pelvis rolls left, right side of the back lifts up. And the more the back lifts up, the easier it is to turn the hips over and for the knee to go down. And when you come back through middle, just let your back sink back down to the floor and then back onto the left side. Rolling the pelvis to the side as you let the knee drop in. And go back and forth like this about half a dozen times, just seeing how smooth you can make the action of rolling the pelvis side to side. And that's what helps you turn the knee in, or the knee to get close to the ground. If your knees don't touch the floor, don't worry about it. You've got the whole rest of your life to get good at this. And eventually, if you practice, you'll get the knee down to the floor without too much trouble. Okay, and come back to middle, legs straight, and rest. That's a sequence for your knees. It's not the only way to address knees, but it puts a few things together that are probably going to help in that regard. Give it a try. Let me know how you get on. And if you like these longer videos, check out my on-demand classes. There's a link in the description. Thanks for watching, and I'll see you next time.